Welcome to American Dreams. My guest today is Jerry Browder, founder of Signet Health. Jerry, welcome to today's show.
Thank you, Alan.
So, Jerry, can you share a little about your background, how you got started out in your career, and what moved you up to where you are today?
Well, first of all, I'm a lifelong entrepreneur. I grew up on a farm in Oklahoma and was trained by a farmer. My father was a brilliant man, not educated in any way, but very entrepreneurial, and he instilled that in his children. And so I've always had that perspective. I trained as an accountant in college and became a CPA and worked through hospitals in healthcare as a hospital CFO. And then 25 years ago, I started Signet Health Corporation. We contract with hospitals to manage their mental health and services and physical rehab programs as well. We take over a wing of the hospital that provides acute psychiatric care for patients in acute crisis. These patients are very, very ill and keep them safe. And provide services to them. And we provide the mental health management services for the hospital client as a contractor for the hospitals and health systems that we serve.
So the mental health field is very large and growing. And how did you get into this particular area, and what has kept you engaged in it for 4 decades?
Well, it is a very large industry. And just to give you a perspective of how large an industry it is, healthcare, as you probably are aware, is the largest industry in the world. And healthcare is the largest industry in the United States. There's no other industry as large as healthcare. In fact, it's 3 times the size of the banking industry, for instance. So it's a huge industry. But in healthcare, mental health is the largest diagnostic category of spending. That's a shock to most people. They think it has to be cardiology. Well, that's number 2. Or maybe it's cancer. That's number 3. Trauma's number 4. Respiratory is number 5. But number 1, more money spent on mental health and addiction diagnoses than any other diagnostic category of spending in healthcare. So it's a huge industry. I was an accountant. I had a farm background, so I actually was working as a cost accountant in my early career for a fertilizer manufacturing company, anhydrous ammonia chemical plant. And a guy at church said, "Hey, Browder, you need to get into the healthcare business." And I said, "Healthcare business, hospital business? I didn't even know hospitals were a business. I thought that's where sick people got well." And he said, "Oh, no, it's a big business." And he was, of course, correct. That was 47 years ago.
You know, you've scaled Signet to over 100 locations across 25 states. And what do you think sets Signet's model apart from other behavioral health care providers?
Well, I think, first of all, it doesn't make us unique, but it makes us unusual, I think. Many people that are on your podcast and that you interact with, Alan, understand purpose and mission. But the typical entrepreneurial journey is about making money and is about being innovative and solving some problem. Frankly, is about the entrepreneur creating something and building a business and having an exit and moving on to the next creative thing. And I am definitely an entrepreneur, and I'm always innovating new things and new next things. But at the same time, our business is mission focused. The mission of Signet Health is to advocate for the vulnerable when they cannot advocate for themselves. We're in the mental health field. And for me personally, that's my personal mission. And so I think the thing that sets us apart model-wise is that the founders, we're in our 26th year. My 3 adult children are basically have taken over the leadership of our organization today. I'm still actively involved, but they're providing the boots on the ground, primary leadership, and we are mission driven. Mental health attracts a certain kind of employee, and so it's self-selecting. It's actually magical, really, because we can't afford to have people working in 100 locations in 25 states nationally who don't really care that much about the patient or what they're doing, and just a job to make money. People have to have a very strong commitment at any given time. Since we started this podcast in 100 locations nationally, 30 to 70% of our patients, depending on the location, would have already taken their own life if they had had the opportunity to do so. This is very very critical. It makes a difference what we do, and it's every day, 365 days a year, forever. And so, what we do is really important, and it's not enough for the leaders to have a mission and a purpose. Everybody in our organization, our 700 employees nationally, have to have and share that common purpose and that common mission. And we have the benefit, we're fortunate that people are attracted. You don't just get into mental health for no reason. You have to be drawn into it. You have to like. It's hard work. It's not rewarding. Very few of our patients have the ability to even feel gratitude, let alone to express it. They might kick or spit on you or pull your hair, and so the employees have to be motivated by something more intrinsic. And as I said, that's magical when you have a business whose purpose is the purpose that our business is. And so that makes us unique in the entrepreneurial journey. People are passionate about what we do, and not just because of the company, but because of their own personal mission. They're drawn to it. And people who don't share the mission just don't last very long in our organization.
I think that the way you said it holds a deep meaning, a value system of helping those who cannot help themselves.
Absolutely. I see all the time our people are helpless and hopeless. They're without hope, and their families are without hope. They don't know where to turn. Anyone who's had any interaction with a family member or friend, and that's nearly everybody, that has had a problem with addiction or a mental health issue, knows how helpless and hopeless you feel. Where do you turn? Where do you go? What do you do? And so we advocate for the vulnerable when they cannot advocate for themselves.
It's interesting. Of course, the world of entrepreneurs are all about solving problems. Money is secondary to putting solutions in place. So I'm going to ask you a tough question here. So working as the entrepreneur, what are the accomplishments that give you the greatest joy?
Okay, number one, as I said, we're unique in our purpose and mission, but we're also unique to some degree, at least, in that, and rather than looking for an exit to, have a pot of money and play golf in Florida and all that kind of thing. Again, I'm passionate, and our family in the second generation now are passionate about something that makes a difference in the world. I mean, who wouldn't want to I have 3 adult children. Who wouldn't want to raise your children in such a way that your children would commit their lives to making the world a better place? Well, who gets to be me? That's who we are. And so selling the business, I mean, why would I do that? Why would I exit? It's an extension of who I am and what I believe. So the number one thing is that I care about the purpose, and I care that the second generation of our family embodies the mission. I don't have to tell them, what our mission is. My children tell everyone what the mission is. They embody it themselves. And I have 8 grandchildren. We're working on the third and subsequent generations. In fact, I hope to write a book later this year to create a path for the third and subsequent generations to integrate into not just the family wealth, but using as fiduciaries the family wealth for the family mission, continuing the accountability as a part of the family through the family mission. So that's number one. Number two, as I mentioned, meaning most of our patients are critically life and death. We see 20,000 new patients a year all over the United States. We save tens of thousands of lives every year. I mean, that's really fulfilling. That's really gratifying, to have built something. I started the company with a yellow pad and an ink pen and very little money and very little access to any money of any kind. We grew very slowly initially and organically, but then we scaled the business and have grown through acquisitions, and we are the largest mental health manager of mental health services in the U.S. today. So the number two thing is the lives that we've saved. There's the president and chief executive officer of our company today has a saying. She says that there's a Talmudic rabbinic interpretation from the Talmud that says everyone who saves a life saves the world. In fact, I think that Schindler's List even had that quote in it, if I'm not mistaken. But that's the way I see what we have accomplished. What I've accomplished, what I've got to be a part of, is God's great work in the world, and we are saving the world one life at a time. So that's the second thing, and the third thing, just quickly, is the jobs that we create. We create jobs for just the greatest people on the face of the earth with the biggest hearts and the biggest desires to make a difference. And I and my children are business people. I'm a financial person. I'm not a clinical person. I don't counsel people. I don't have that skill. But I have the skill of creating a business and a system that creates the economic capability of providing jobs for employees all over the country who get to go to work every day and make a difference in the lives of others. They raise children, send them to college. They have families. This is the third thing that I'm really proud of, is creating jobs for people that matter.
Now, Jerry, as an entrepreneur, there's a saying that you've often mentioned, that children that grow up in a home that has parents off as entrepreneurs end up choosing different paths. How has that been different for your children?
Well, my children, when they started going to college, the last thing they knew that I was a CPA, a financial person, and they knew that I had a business by the time I started the business the year my oldest child, my daughter, went to college. And the last thing they were going to major in was finance or accounting or business, anything. They didn't want anything to do with it. So the first one majored in home economics. The second one majored in music and sound engineering. And the third one majored in elementary education, became a third grade math teacher, or fifth grade math teacher. And so they didn't want anything to do with what Dad did, just typical of entrepreneurial children, But as they got through college and got involved and engaged, they began to mature enough to realize that they were going to have to make a living. And so they began to ask some questions, and I said, well, you want to learn more? And, well, yeah, we're curious. And, they began, as each one of them got into college and got it to a certain stage. And I said, well, want to make some money? And so I paid them to do an apprenticeship that we call the University of Dad. It was remote learning, and I developed a curriculum, and they went through a self-paced, study, and so each one of them did various parts of it. But In fact, again, that's another book I'm going to write this year is to document the University of Dad and how the second generation was engaged. But it got them engaged, got them interested. And, my children today run our business and have been involved for 2 decades now at one level or another and have made uh, the youngest one, uh, became, he was a fifth grade math teacher and he was a youth pastor for a period of time. He's also been the CFO, been a salesperson for our company, been the CFO for our company, and been the CEO for the last 3 years until recently of our company. And so they've advanced and grown and developed and grown up in the business, and they embody the purpose and mission that we have today. So they kind of got the summary answer to your question is my children got sucked into it and couldn't get free basically. So they got wooed into it. They got drawn into it.
You've emphasized purpose and mission throughout your work. What sparked that focus for you personally?
Well, it has to do with faith, really. I think most entrepreneurs, uh, it's my bias that they have a faith. Obviously, not all, but man, it's pretty hard to be an entrepreneur if you don't have faith. Uh, if you don't have faith in a power greater than yourself, it's pretty hard to do. For me, again, I trained as an accountant. I grew up on a farm. Very different and very far from mental health and being an industry leader in the mental health field. But you look up finally and say, this must be what God wants me to do. I have friends that, share that they've had a vision, had a dream, or heard a voice, or, I haven't had any experience like that. But I'm pretty convinced at this stage in my life that I'm doing what the creator and sustainer of life intends for me to do. And I get up every morning and get to do something that really matters to the one who I believe created the world and controls the world. I get to be a part of something much, much bigger than myself because of the faith that I have. And so I believe I have a calling, and I believe that calling extends to my family just like it did to Abraham or to Moses or others. And so, um, and I think it applies to everyone. Everyone has a purpose in the world. We're not just randomly born. That's not what I believe. And so, the purpose and the mission really has to do with a personal belief that I have a calling. This is what I'm supposed to do in the world.
In addition to Signet Health, are there other projects or causes that you are involved with?
Oh yeah, oh yeah. Being an entrepreneur gives me a lot of freedom, and I'm very active. I'm interested not only in mental health, but I'm interested in children. I'm interested in the poor. Uh, and so I have served on boards of a lot of not-for-profits over the years and helped, because of my financial skills, that's often a big draw, as you probably are aware, because you have the same background that not-for-profits struck. I don't have uh, difficulty drawing big-hearted social workers, but financial minds, financial people, business people sometimes are more difficult for them to draw leaders for. And so I've been involved with Habitat for Humanity, uh, a group called Arms of Hope, which is about single moms, provides a path for single moms to to break the multi-generational cycle of poverty. And children's homes with children who have not had the great opportunity for parents like the great parents that I had, the great raising that I had. And so those kinds of organizations are kinds of things that I've focused and committed not only my time, but my treasure to as well.
Jerry, what advice do you have for aspiring entrepreneurs?
Well, a couple of things. I've talked about purpose and not to beat a dead horse, but uh, do something that matters. Do something that matters in the world. Commit your life at the end. I'm an identical twin. I have a twin brother. We're 71 years old, and we still talk to each other every day. We were in the womb together, and we're very, very, very. We have all kinds of kooky, weird twin experiences. But my twin brother says, at the end of the game, the pieces go back in the box, and the box goes back on the shelf. And so making money and building an empire and, or having prestige, the, ego stroke, all the things that entrepreneurs, frankly, have to have in order to accomplish what they do, is not enough. It's important to make a difference in the world. So while entrepreneurs solve problems, I would encourage an entrepreneur, aspiring entrepreneur, to attempt to solve problems that that are big and that can be big and that can make a huge difference in the world, and to make the world a much better place. And the second is, the statistics, I think, are 90% of the people who aspire to be entrepreneurs will never take action. And so I think that has been one of the things that has benefited me most, is get out of my way. We're going to take action. We may screw up, but we're going to take action. And so, my second advice would be go for it. The third one, I can't avoid just because of my background, is it's going to take a lot of cash. And cash is king. And if you don't have any idea about cash, don't start a business, because whatever the business is, it's going to require cash. And when you start a business, tell young aspiring entrepreneurs that you need to develop a budget or a plan, a strategic plan to determine how much cash that you're going to need. And then one of only two things can happen. You'll either do worse than you expected. And bad news, if you do worse than you expected, it's going to take more cash. Or you'll do better than you expected. And if you do better than you expected, it's going to take more cash. And so the one thing is you're not going to hit your plan, and that it is going to take more cash than you had imagined or expected that it would when you began. So that's the third thing I would say that I would advice I have for aspiring entrepreneurs.
Jerry, it's been a pleasure having you on today's show on American Dreams. When everything's said and done, I love the way you talk about the box goes back on the shelf. How do you want to be remembered?
Man, I'm not sure I know. I want to be remembered as a good person. I'd like to be remembered as a humble person who followed what his faith of what he believed that his purpose was in the world, I guess. And I'd like to be known, frankly, I'd like to be known as generous. That would be really good. Sometimes when I share with others, they say, well, that's awfully generous of you. And I always respond, well, excellent. That's exactly what I intended to be, was generous. I don't want to be known as stingy. So I would like to be remembered as a generous person.
Jerry, it's been a pleasure having you with us today.